Good morning, folks. Thanks for joining CCN, Consumer Care Network. This is Consumers Doctor, Dr. Bengala. Consumers, healthcare consumerism. Today's topic about consumers in healthcare. Healthcare. Oh, we should congratulate our Vice President Biden. He's going to be our next president. You know, the beauty of democracy is the divided government. As a matter of fact, maybe it's good for the America because America was so split and divided. Right now, the government is divided, but they can do good things for people. Consumers out there, you want to be free from healthcare. You want to be financially independent. Folks, young folks in their 40s and 30s, they have such a bright future ahead because technology is going to help us and it will take us there. And the freedom, what we should have a freedom in healthcare. That's where the beauty of how do you get to be free from all these rules and regulations in healthcare. It's very easy, folks. It's very easy. A lot of people don't understand this. If you're working if you're self-employed, you're working for a small organization, if you're working for a large company, you're a teacher, you're a city worker, a city employee, it doesn't matter where you are. You need to seriously consider this fact for you and your family, folks. You really need to get hold of this health solutions advantage accounts like HSAs. To qualify, you need to have a health disclosure healthy pricing plan called HDHP. What will happen is it's like this is an asset, folks. This is an asset. Take care of it as an asset. This is not a liability. This is an asset. You can make money off of this asset. You can work hard and make money. I'm sure Americans generally are work hard than any other. Most of the American works 14, 16 hours a day. They work hard and they need to reap the benefits. Healthcare is one thing they can reap a lot of benefits, folks. What I encourage you to be a part of health disclosure, healthy pricing. Once you get this HDHP account set up, it's very easy, folks. It's very easy. You have HDHP accounts all over, and even missionaries are offering HDHP accounts. Get the HDHP account set up, lower your premium, whatever you're saving, put money aside into Health Solutions Advantage called HSA. It could be 100, 200, 300 every month. Whatever you're saving from your insurance, make sure you're insured. I encourage everybody to have the insurance. It's like having your car or your home. You have insurance. Majority of Americans have cars. Majority of Americans have homes. It's a duty. You have to have insurance. You need to cover yourself. Ultimately, the cost will go down once you are in the driver's seat. I want insurance companies not controlling. I want you to control the insurance. I want consumers to be in the driver's seat, and I wish, I see these Medicare advertisements, it's mind-boggling. They want to, there's a Medicare advantage. You have a free dental, free eye checkup, free this, free that. It's all. But one thing I notice, insurance companies are so smart. I don't see Aetna, Blue Cross, Humana advertising. I don't see their names. You just see 800 number Medicare Advantage. Why can't they be more transparent? It doesn't, we all know that you're going after the Medicare dollars. Medicare has it's going to be insolvent the way intermediaries are raping the system, it's going to be insolvent. There's no way it's going to be solvent. What I'm suggesting is, consumers out there, if you're smart, just be proactive. Set up this health disclosure, healthy pricing. Once you have it, it's guaranteed for life. It's a guaranteed. Your premiums are lower. Put money aside on an ongoing basis. It doesn't matter if it's 100, 200, or 300. Maximum we can go up to 300. And put money aside every month, and you come out ahead in the long run, and you will be financially. And there's a triple tax benefit, folks. All this IRA, SEP IRA, they have only two. They have only, these are the payments are after taxes, and the income returns are tax deferred. That's the only advantage there is in IRA or Roth IRA. Whereas in health solutions advantage, HSA, you have a triple tax. You don't have to, when you're contributing, you don't pay taxes. It's tax deductible. And number two is income, whatever the revenue. Fidelity has HSA account. Anybody can set it up. It's very simple to set up an HSA. Fidelity HSA, look into that. And third, withdrawals are tax deferred for your health care. So you have a triple. Why won't somebody take advantage of that? I think a lot of people are ignorant of the fact this health solutions advantage, HSA, is the way to go to make you be, the funds. I've seen the health solutions advantage. There are a lot of people are participating now, and it is the way to give you not only financial independence, it will give you independence from the surprise medical bills. These surprise medical bills is, though so many people are not able to afford. I was in the hospital for 23 hours, got a bill for $227,000. That's what ticked me off, and that's why I'm doing this. I'm not blaming anybody. I'm not blaming the doctors. I'm not blaming the hospitals. I'm not blaming anyone. But that's the system. We need to, ultimately, if the consumers are in the front line, when the transparency comes in, you have to have a transparency in healthcare. It's no doubt. Affordability, competition, and transparency. So-called ACT. Affordability, competition, and transparency. It is so critical. We need all those three elements. And we also need these 5 elements from ACT, Affordable Care Act. Those are important. Guaranteed health coverage, number 1. Guaranteed health coverage for all Americans. And you have to have pre-existing illnesses. Number 2, pre-existing illnesses need to be covered. And number 3, transition. 26 is ideal from parental to independent individual coverage. And number 4, catastrophic coverage. All Americans need a catastrophic coverage. And number 5, major medical coverage. Those 5 elements, Affordable Care Act did one good thing. Maybe we can take advantage of it and implement them with those 5 fundamental principles in any. I want consumers to take charge, Americans to be in the front line and free, choose what they want. They should be able to choose their doctor, they should be able to choose the facility, they should be able to choose insurance companies. They need to be transparent. Insurance premiums have to be transparent for, as I said, for 4 different categories. As I mentioned earlier, for 4 categories. For well category, 63% Americans are in well category. 16% of them have chronic illnesses. And you have a third category, is called at risk. That 20% at risk. And you have the last category is what is it? Last category. This is where catastrophic. Those four categories, they need to be transparent. For catastrophic coverage, how much is the premium? At risk category, how much is the premium? For well category, what is the premium? They should be going after the consumers should have that choice, folks. This is my goal. Consumers to make a choice. Consumers to decide which insurance to get, which doctor to go, where to go, how much to pay. They can pay as they go, and this surprise medical billing needs to go. That is just not practical. They have. I think slowly it's going to be gone. This medical billing system will be gone once you have this health solutions advantage take hold. Again, thank you for joining this channel. This is Consumers Doctor, CCM, Dr. Bengala. We will see you next episode. This is part 2 of Consumers' Freedom in Healthcare. Consumers' Freedom in Healthcare. We will see you in the next episode. Thanks again.